Aloha! How are you? My name is Dr. Jemimah Karaoke. Today we are going to be discussing about sexually transmitted illnesses on our channel, Wills for Life by Dr. Jemimah. Stay tuned. We are going to start with gonorrhea. So what are sexually transmitted illnesses? These are diseases that we get primarily from sexual intercourse, which means if you did not have sexual intercourse, you would not have them. And now because sexual intercourse has been expanded, that means oral sex, it means anal sex, it means penetrative or vaginal sex. All of that. And if you're one of those ones who you use sex toys, it means also sharing sex toys. So all of those predispose you to getting sexually transmitted illnesses. And no judgment here, we don't have any judgment, but they need to be treated, they need to be prevented. So why do we see a rise in sexually transmitted illnesses? One, because of contraceptive, because people no longer are scared of pregnancy. They're not using protective mechanisms or barrier methods such as condoms, and therefore we're seeing a higher and higher risk of sexually transmitted illnesses. Two, multiple sexual partners are on the increase, and therefore we're seeing again a rise in STIs. Three, we have a lot of not polyandry, but the reverse. We have polygamy and polyandry that is also causing legal sexual partners. We have earlier sexual debut with high body counts, and therefore if you know you have any of these risk factors, then earlier sexual debut, start sex quite early, because again we have a lot of information out there. Our young kids, our young teenagers are engaging in sexual intercourse early. So we are seeing an increase in sexually transmitted illnesses, something that are preventable if we're using protective mechanisms, especially the condom, especially if you're using it right. If you don't know how to use it, we have a video here that shows you how to use a condom correctly. But if you do know how to use it and you're not using it, please know contraceptives do not protect you from sexually transmitted illnesses. So what are sexually transmitted illnesses, or examples of them? We have gonorrhea, we have chlamydia, we have HPV, so what causes cervical cancer, we have herpes, we have HSV, and we have HIV. So there are really many examples of sexual transmitted illnesses, and most of them have a cure other than HIV, of course, which I'm sure Dr. Samuel is working on, because we love you guys so much. So let's start on gonorrhea. So what is gonorrhea? Gonorrhea is a bacteria. It's called Neisseria gonorrheae. It's a 2-cell bacteria that can affect the oral tract, can affect the anal tract, it can affect the penile tract, but doesn't affect the vagina. So what does that mean? It means that for women, you may be having gonorrhea and you don't know about it, because the vaginal area is resistant because of the type of cells that the vagina has. It's resistant to gonorrhea, but the cervix isn't. And the endometria is not, the uterus is not resistant. So you may be having asymptomatic gonorrhea, and therefore you're able to spread this to other people that you're sexually relating with. So what are the symptoms of gonorrhea? In females, you have 50% of us will have symptoms if we are female with gonorrhea. And one and the main one would be dysuria. Dysuria means pain when passing urine. You can also have pain when passing poop. and that's because of the irritation of the proctitis near the anal region. So you may have pain around that, and discharge. The discharge that women have is whitish yellow, and it's purulent. Purulent means it's a lot, like it's just a lot. And then around the Bartholin glands will have sort of like a heaviness or a congestion, and it will just feel, let me just, for lack of a better word, say heavy. Okay, because it can go through the sperm of men upwards from the cervix into the uterus, upwards into the internal reproductive organs, that is the tubes. And that purulent fluid, that fluid that I'm telling you is a lot, can cause a block of the tubes. It can cause a pain under the liver, because when you lie down, the fluid will flow down. So you have pain around the liver area. So you just have right-sided weird non-discomfort pain. For some people, they can get fever and septicemia. This just means that your blood seems to have a very high infection. But if we don't pinpoint to that area of the cervix and the labia and the Bartholin glands, we may not know it's actually gonorrhea. Okay, for some people, as it goes to the bloodstream, it can go all the way to the brain, giving you a different type of meningitis, although there's a blood bacteria specific and very close to that gonorrhea is called N. meningitidis, that affects the brain meninges, giving you convulsions and whatnot. But gonorrhea can also affect the brain. Okay, so as you can hear, it's a really, really nasty infection. For women, for men, when they get gonorrhea, most of them will know, because they'll have pain along the penile tract. Very severe pain along the penile tract when they're passing urine. They'll have pain around the testicles as the pressure of the testes increases. They'll have pain around the prostate gland, and then they will also have greenish yellow discharge. Okay, so if your partner has these symptoms, or if anyone around you has these symptoms, then please note, you both need to be treated. One partner having gonorrhea means both of them need to be treated. The other is, if you have oral sex, you may have itchiness around the throat, just an itchy, irritating feeling. Okay, so that's for both people, male or female. Okay, so I hope that clears up in terms of symptoms. So how do we know that you have gonorrhea? We'll do lab tests. We'll come, we get part of that mucopurulent discharge, we'll take a swab, we'll take it to the lab, we'll do something we call a NAT testing, and then it will tell us, and we'll also put it under culture media specific for gonorrhea, and we're able to see the diplococci bacteria, and we'll be able to know that this is gonorrhea. So what we do when we find that you are positive for gonorrhea, we treat. Treatment is antibiotics, because it's a bacteria, and the antibiotic of choice is ceftriaxone, especially if you can get it in the original form. We're going to give it in your arm intramuscularly, about 500 milligrams start. But if you're allergic to ceftriaxone, we can also give azithromycin 1 gram start, and doxycycline 100 milligrams twice a day for 14 days. Okay, you'll notice that generally we tend to combine that treatment. We call it the PID treatment, and that's because there's a relative of it called a relative of gonorrhea called chlamydia trachomatis, that affects mostly the same areas. It will affect the cervix, it will affect the lining of the urethra, it will affect the uterus all the way. And it's actually the most common STD. Gonorrhea is the second most common. So chlamydia is most common, and the treatment is almost similar, and even the presentation is almost similar. You'll have pain when passing urine, you'll have the discharge, you'll have pain if you're a man when passing urine, you'll have that feeling of swelling around your testicle and congested feeling along your battling glands, and it mostly is asymptomatic because it will affect the cervix going upwards. Most common cause of PID, most common causes of infertility secondary to PID, or blocked tubes. Okay, so chlamydia and gonorrhea are usually quite together, and how we treat is the same: ceftriaxone, azithromycin, and doxycycline. If that regimen is not comfortable for you, sometimes you go to cefotaxime or cefixime. We can also use and combine it with doxycycline. When we're treating complete PID, we also add metronidazole, 400 milligrams 3 times a day for 14 days. Why am I giving you the dosages? Because sometimes I know there's a lot of stigma when it comes to sexually transmitted illnesses, and I know that it is really readily curable. So if you feel you're unwell, kindly go to hospital. Let you be tested. Let us do partner testing. If you're somewhere where you're in a fix, especially if you're a teenager, you don't want to go to hospital, you don't know what to do, at least now you know what you can do in terms of treatment regimen, because we've seen a lot of cases of infertility because of pelvic inflammatory disease and tubal blockage. Okay, so we'd rather be safe and sorry, and as we say, education is power. So I hope that clears out gonorrhea for some of you. We are going to be posting how it looks. It looks nasty, so forgive us for the image that you will see, but we want you to feel to get treated, to know the symptoms early on so that you can seek early treatment. Thank you. Once again, it's been your Dr. Jemimah Karaoke. I'm an obstetrician gynecologist. I am found at CK Patel, 9th floor, Kenyatta Avenue in Nakuru, or virtually you can find us or find me in Wheels for Life app. I'm there on Play Store or Google Play. You can download, find, and book a virtual consultation, or if you want to call 0719 116611. Also across all socials, Wheels for Life by Dr. Jemimah. Let's interact. Ask your questions. Let me know what else you want to know, and subscribe, like and share. Thank you so much. Been a blessing.
Life is busy and sometimes health concerns can't wait. With Wheels for Life, healthcare is just a tap away, anytime, anywhere. Whether it's a fever, a routine checkup, or something urgent, Wheels for Life connects you with licensed doctors in minutes. Get expert care from trusted doctors, specialists, and counselors without leaving your home. From prescriptions to follow-ups, Wheels for Life helps you manage your health on your schedule. With Wheels for Life, healthcare is no longer a hassle. It's fast, secure, and always within reach. Download Wheels for Life app from Apple Store or Google Play Store today. Wheels for Life, fast, convenient, and secure healthcare in the palm of your hand.